have Waukesha County Executive Paul Farrow, Waukesha County Public Health Officer Ben Jones, Wisconsin National Guard spokesperson Joe Travato, and member of our Workforce Development, Laura Catherman. Once the news conference is over, you can ask questions, and once testing starts, we have an area where you guys can take photos and stuff. The area is blocked off due to HIPAA laws, so there is a specific area where you guys are going to take video from. So let's get started with Waukesha County Executive Paul Farrow.
Good morning. Just want to thank everyone for being here today. Today, Waukesha County is announcing our continuation of the Stay Safe to Stay Open campaign and kind of the increases that we're looking at as we go into the fall dealing with the coronavirus impact. About a month ago, we were together with a number of the school districts in Waukesha County to announce our partnership, knowing that our goal was to prepare the students to come back to school and continue the education they so desperately need. At that time, our case numbers were pretty high in Waukesha County in July. We asked the community to take responsibility to help us reduce the impact of the virus, and today we can see our counts has declined. We've seen some good news and some good numbers. We know that we're not out of the woods, but we're on the right path. The other thing about today is the first day for school for a lot of those students. And it's a great opportunity to say thank you to the schools, the districts, the superintendents, their staff, for all the hard work they've put in this summer to prepare for this day. And the thing that we've seen throughout the county is each community is looking at how they can approach education a little bit differently to provide that solid education, but at least as well maintain the safety and well-being of the students and the staff. And we want to continue that effort. So again, we're going to ask people as we move forward through the fall to continue to keep in mind the CDC recommendations. Protecting those vulnerable populations that we have, keeping them quarantined. If you feel sick or feel like you have symptoms, stay home, stay isolated, contact your physician. If you're going to be out in public, make sure that you're looking at 6 feet of distancing between you and your others. If you're going to be indoors or you can't have that distancing, make sure that you're wearing a mask, and then follow CDC guidelines for proper hygiene. You know, one of the things as we look at the fall, our challenge isn't only going to be the coronavirus. One of the challenges that we're going to have right around the corner is flu season. And so when you combine these two issues, this is a time that we want people to really be vigilant about what they're doing and watching and preparing for the fall. One of the things that we constantly look at is how we can at the county put our best effort together to make sure that we're combating not only the coronavirus but the flu season as it comes forward. Waukesha County recently has kind of restructured our operations as we prepare for the fall and as we move forward through the coronavirus, knowing that we've learned over the last 6 months. And we now have about a four-pronged approach as we're dealing with this virus. The first, we have enhanced the partnership that we have with our schools. And we've been working on that throughout the summer. That is going to allow us to have better contact tracing, better contact with the schools to watch where the patterns are growing, if the students are getting sick or if staff is getting sick, and how we can help them. The second area, we've improved our ability to collect and visualize data dealing with the coronavirus. We've created and updated our dashboard to give the education field, the community, and actual municipal leaders as well, information on operational things day to day, what's changing and where they can get it. The third, we have significantly enhanced our contact tracing. To date, we've hired almost 200 new contact tracers and disease investigators to help augment what we had in place. And if that is the effort that we continue to move forward on so that we can reduce that spread as much as possible as it moves forward. And finally, we've boosted our partnerships with organizations like the National Guard as you see them getting ready to set up to increase our testing here in the county. And I want to again thank the National Guard for their efforts throughout this entire pandemic and what they've done across the state to help increase the number of testings that we're able to do. Keep in mind as we move through the fall, we're going to have challenges. As schools open up, as fall sports go back, we may see spikes that will occur, so it doesn't impact our healthcare systems. But we also have to keep in mind that we're going to have shortages of testing, as we've heard. There's going to be other challenges, and if we have a large spike, there may be a challenge in our contact tracing to keep it on a timely manner. So those are all things that we continue to keep track of as we move forward. As we look at the fall, I guess the one thing is we're getting prepared. What we want people to realize is this isn't going away. We have to be vigilant in what we do, have to maintain our practices that we've had throughout this first 6 months, but then we also have to prepare. So I'm asking people today, and you'll hear it again, to go out and get your flu shots early this year. Make sure that we're doing the best that we can, each of us, to maintain not only the coronavirus, but the flu spread as well. As we move through the fall, keep in mind, as I keep kind of talking about them all the time, the things that we can do, keeping our vulnerable populations quarantined, keep them safe. If you feel sick, the most important thing you can do is stay home and contact your physician and see where you need your next steps are. If you're going to be out in public, keep that 6 feet of separation. If you're indoors or you can't keep the separation, make sure that you're wearing a mask and follow the CDC guidelines when it comes to hygiene. Lastly, if you get a call from the Waukesha County Public Health Department for the contact tracing, please pick up the call. Talk to them. They're not there to antagonize you. They're there to help you. They're there to give you advice on what to do next. And it's important for us that we know where the spread is occurring, and that's what we do with our contact tracing. So with that, I'd like to turn it over to Ben Jones, our Public Health Officer, give you a little more information.
Thank you, County Executive Farrow. As we stand here today, we do have many challenges. However, there is good news to share. When we announced our partnership with schools in July, we were in a challenging place, not only with the total number of active cases in our county, but with various spikes in cases. The last week of July, we were seeing well over 100 cases per day, but have seen steady decreases throughout August, and for the past week, we are seeing on average 46 cases per day. We must continue to be vigilant, though, to ensure cases continue to decrease and remain low. The encouraging trends we have seen put our county in a better position to ensure that students can get the face-to-face instruction that is vitally important, not only for their developmental, social, but emotional needs. While August has seen lower case numbers than July, it is important to note that almost 2,000 cases were received in August, which represents about 35% of our total cases. And the age groups of 10 to 29 are still driving up that total, with 675 cases, or over a third of all our August cases. We would also like to see our daily testing numbers higher than they currently are, which is one of the reasons we're here today. As we know, an appropriate level of testing is a key factor in helping control the spread of this virus. It only takes 1 or 2 outbreaks to put us back where we were a month ago. Waukesha County aligns with the CDC in the belief that taking appropriate precautions to safely open schools is the best option for most children. Younger children have needs that can be best met by being in school. They are also believed to be among the lowest risk group for getting severely sick from the virus. We know that the greatest risk from opening schools is students' connections to the community as a whole, and their ability to spread COVID to vulnerable populations, like grandparents who are at higher risk, or family members with underlying health conditions, which makes our stay safe to stay open recommendations extremely important. County Executive Farrow mentioned some of the new structures we have in place to enhance public health's ability to manage the situation. One of the biggest wins we want to talk about today is contact tracing, which is one of public health's oldest and most reliable tools. You have probably already encountered it in your life because it has been effectively stopping outbreaks in schools for decades. If you ever gotten a note from school about a case of pertussis or whooping cough or other vaccine-preventable illnesses, that was because school officials worked closely with public health to find that source of infection and stop the spread. Today, we would like to share that Waukesha County has significantly bolstered its infrastructure to be able to effectively contact trace even large outbreaks. Since the pandemic began, we have hired and trained 225 new staff as contact tracers and disease investigators. Our ability to attain these numbers is in part due to our partnership with Carroll University, which has helped us train over half of those new people. In addition to adding these new staff, We have trained school nurses and other staff to be able to contact trace COVID-19 within schools. This partnership between schools and public health will be a powerful new way to use contact tracing to stop the virus in schools before it can spread. We are working hard to increase testing in Waukesha County, which you can see by looking around here today. We know that adequate testing levels are vital to knowing the level of disease that is out there and to keep it from spreading. The county does not conduct its own testing, but we have been working with community partners to find ways to increase testing overall and to sustain it at acceptable levels. We are asking for your help. If you are sick or have been exposed to COVID-19, stay home, talk with your healthcare provider, or visit our website to find out how you can get tested so we all can stop the spread of this virus. Obviously, our partnership with the Wisconsin National Guard is a major factor in our ability to test. I'm happy to introduce Captain Joe Travato of the National Guard.
Thank you for that. We're honored to be here today. We do have a great partnership with Waukesha County. In fact, this is, I believe, the third time that we've had a testing site at this particular location in the last few months. The first one dating all the way back to May. So it has been a great partnership with Waukesha County and all the communities across Wisconsin as we've worked together to try to get a handle on testing across this entire state. By this time, most of you are probably familiar with what our testing process actually is. But again, this is a fairly quick and painless process. You can pre-register to be tested at these sites, including this one. When you arrive, you would simply check in. They'll verify some administrative information, and then you proceed to the testing station. As you can see, the team is just arriving here right now, and they'll be getting set up and establishing the testing lanes here shortly. But once people arrive at the actual testing station, it really just takes a couple of seconds. It's a quick swab, and then from there they're going to receive an information pamphlet, and from there it's basically you're going to receive your results in a couple of days at most. So there have been some reports earlier in the process that indicated that testing wait times were long, or even that the results notification was a longer process. Right now, we're seeing test results in a matter of a day or two, but we'd still tell people it's probably about 3 to 5 days. Excuse me. But we will have a team of about 20 to 25 soldiers that will be supporting this site, and we're going to have several sites over the course of September working in partnership with Waukesha County. I believe there are 8 total testing days in Waukesha County at this site, and right now we're looking at about 600, the capacity for about 600 tests per day. So the county continues to own this site. The National Guard always serves in a support role, so this is a county-run site, and we are working directly with the county in that support role to ensure that we can provide this resource. And it really has been a great relationship, and we're excited to be here again to be able to provide it going forward through September. I just want to close by saying it's an honor to assist our communities during times of need. This is what the National Guard is all about. We have 2 major missions in the Guard. Yes, we have our federal mission where we can deploy overseas to a combat theater and defend our country, but we also are the first military responder here at home during times of emergency. So while serving in a pandemic may be something that's new for the Wisconsin National Guard, serving our communities, serving our state during times of need is not something that's new for us. This is frankly why most of us sign up and wear the uniform, because we want to serve our own communities. We live and work in these same communities as well. We're your neighbors. In fact, myself, I'm a Waukesha resident myself, so it's really always special to be able to see National Guard troops here serving in my own community. That means a lot to me. We truly are citizen soldiers, and so we're invested in these communities, and we're invested in trying to combat this virus and help in any way that we can to assist in getting us back to some sense of normalcy. So again, I appreciate the opportunity to be here today. We're grateful for the partnership with the county, and with that, I want to introduce Laura Catherman, who's the Workforce Development Board Director. Thank you.
In order for testing and contact tracing to be really effective at the community level, we wanted to make sure our efforts were aligned in two key areas, and that was getting effective relationships with school districts and public health, and also enhancing our data visualizations. We want to make sure the community is really well informed so they can make really well-informed decisions. So as of today, we have all Waukesha County public school districts and 80 private school districts on board to safely open in a way that works best for their school populations. After months of meeting and working together, we've convened superintendents, school board members, public health, school nurses, and health aides to align best practices and ensure everyone has the resources they need to make decisions about what's best for their school district. Waukesha County has empowered school districts to make that decision, but assisting them with the data and information and public health guidance that they need to make strong decisions. We know data-driven decision-making is really important, but we also know that there's not a one-size-fits-all approach that's going to work well for every district's unique population. This is a really complex issue and it's multifactorial, so school districts will be looking at, in addition to data, they'll be looking at things like what are their staff and student absence rates? Can they get substitute teachers when they need them? Do we have effective contact tracing? So there's a lot of things that will play into their individual decisions, and the county will continue to be an active partner in providing timely data and public health guidance so they can make those well-informed decisions. In addition to helping schools, we also want to make sure our businesses and other community members are well informed. So we launched a new dashboard a couple weeks ago that provides additional data, again, to make our community members well informed so they can make those well informed decisions. The new dashboard has active cases by school district boundaries, by age group, so parents and schools can monitor and see how many cases there are in school-age children in their individual district boundaries, as well as within their community. So parents in the community can monitor and see where those trends are going over time. You may also notice that we've added a hospital tab to our dashboard. We're pleased to announce that we have been able to work with all of our Waukesha County healthcare systems to get them collaborating and sharing data so we can really monitor one of the most critical issues of the pandemic, which is hospital system capacity. So we actively monitor our acute and ICU bed status as well as ventilator usage and how many patients are hospitalized with COVID across Waukesha County. So we are really happy to work with our hospitals in this partnership effort. We're also providing some additional community impact. So we can't ignore, there's certainly health impacts, but there's economic and community impacts as well. So Waukesha County has been really providing this along the way, but we've enhanced the information that we are putting on the dashboard. So we have unemployment rate, unemployment insurance claims, and some additional information so we can monitor the economic health of our community. While we are not where we were a few weeks prior to the pandemic, we have seen numbers trending in a more positive direction in recent months, which is great to see. The data that we get for our dashboard comes from the Wisconsin Department of Health Services through their statewide database. So we strive to update our dashboard every day by 3 p.m. on weekdays. However, sometimes there are interruptions to the statewide database that make that difficult. So as soon as we get the information, we post it. Timely and accurate data are two of our top priorities. So we're always striving to achieve that so the community has the most up-to-date information at all times. Over the course of the pandemic, Waukesha County has worked hard to streamline processes to make sure we're providing accurate and timely data, to make sure our residents are well informed so we can work together to get through these unprecedented times and get to the other side of this pandemic. Thank you.
Real briefly, I just want to introduce the people that are behind me as well. Lisa Roberts is over here, who is our Deputy Director at DHS. Will Elmsley works in our Health and Human Services area a lot with the data. You've been going crazy putting all the numbers together, and we appreciate that. And then Gail Goodchild is in our Emergency Operations System. With that, we're all done. If you have questions, we'd be happy to answer.
You said about 200 new contact tracers have been hired. What is that compared to what it was? Is that double, or how many were there? What are we adding to?
And I'll have Ben say, I think we were at 8 when we started.
Oh, okay.
Yeah, so the typical public health staff that would do this kind of work routinely, we had 8 public health nurses. So we've increased over the summer with the bulk of that coming in the month of August.
And you said about right now in the last week, about 46 new cases per day?
Correct.
Okay, awesome.
So you're at a total of 200 now? Or
We have
208?
It's 225 individuals. Now, not all of them work exactly 40 hours, so I believe it equates to about 180 FTE. But a significant amount of individuals are working on this that weren't previously.
And then I'm sure all the information of when this site is open is online, but just for folks, it sounds like I think it's around 8 days this month. Is that right? Does anybody kind of just like run through the actual schedule?
Yeah, we'll have a press release. A press statement will be going out that'll have that information. But there'll be 8 days that are here. It is today, and then I believe it is next Tuesday, and then it's the following Monday and Tuesday, I believe, the rest of the weeks as they go through. And like the captain said, they've got a capacity for about 600 tests per day.
Awesome. Thank you, guys.
You had mentioned that if you see a call from the Waukesha County Health to answer, could you kind of expand on that? Has there been an issue with people answering? Are you just feeling they're avoiding you?
Well, I think what it is, there's a lot of challenge that people aren't quite sure what the contact tracing call is and what people are looking, the information they're looking for. When we have a call investigation, we're trying to get the information of where they've been so we can reduce the impact of the spread. This isn't data that we're collecting, that we're disseminating to other people. It's just to find out where the spread is, who they've been in contact with, so we can reach out to them to let them know that they should consider themselves a close contact and follow certain protocols to keep safe.
Do you feel people aren't answering the calls, or are you not getting as much feedback as you want?
Yeah, we've had some challenges in the past, and I think we've cleared a lot of that up with the new testing and new training that we've gone through. So we're in good shape. We're just recommending people again, especially as we go through school and you're starting to see everything open up for the fall, we want to make sure that they answer those calls so we can get the information on a timely basis.
If people aren't getting the call, should they call you and say, hey, I haven't received the call?
Yeah, there's a number they can reach out to for the public health if they've got questions, and we'll have that on. We've got that on our website.
That covers it.
Yes.
Thank you, guys.
All right, thanks everyone.
Thank you guys so much.